Okay, 149 right now, and we want to get to a very important topic about Mpox cases. We had a notice this week that came into our station that said Mpox cases have been increasing in Chicago, with 13 cases reported in just 1 week. So we put in a phone call to Dr. Monica Mercon of Cook County Health to try to get to the bottom of what is going on. Thank you so much for joining me this Friday.
Thank you. Happy Friday.
Happy Friday to you, and give us the details here. Is what I just said, is that correct from your standpoint as well?
Well, it's so the fact is that we had an uptick in cases of Mpox in the summer months in Chicago that has been through from June until September. And in fact, there has been like a declining number of cases since the previous month. So the peak of cases were in the month of August, September, and now it's declining. So we had a declining number of cases of 5.8% in the last month. So it is true that we had an uptick compared to the other years, but we're now in the descendant phase of this outbreak.
So it's kind of a delayed reaction that we're getting now to information.
Right.
Okay, all right, I understand what you're saying. What do you think caused that uptick?
We don't know for sure how the uptick started, but for one thing that we know is that during the months of summer and all the events in the summer, people have more skin-to-skin contact, more people are traveling, and virus don't have borders, right? So they come back, and there's transmission in the population. We had a concentration of cases in the north side of the city, and the number of cases, it was about 124 patients, 124 cases so far since the beginning of the year, which is not a lot compared to the previous epidemic that was worldwide in 2022, where we have thousands of cases in the city of Chicago.
Wow. And for people who don't understand Mpox, what is it?
Well, so it's a viral disease. It's a virus that transmits from skin-to-skin contact, close contact. And it's not a sexually transmitted disease, but the risk increases when there is more skin-to-skin contact. So during sexual activity, there is more skin-to-skin contact, and you need the contact with the active lesions to actually transmit the virus. There is a beginning of the infection, starts like a flu, like runny nose. You can have some malaise, some fever, swollen lymph nodes, and then in 1 to 4 days, there's a rash that appears, and the rash looks like little bumps or little vesicles, and it can be very few, very isolated, or many of them. And they continue on coming up to 2 to 4 weeks. And then it and the lesions can be quite painful, or they can be completely asymptomatic. So there is a lot depending on the immune system or the interaction between the host and the virus, but it is a self-limited infection.
Wow. And is there, I mean, it seems like, I know we don't call it the same thing we used to call it, but why are we maybe talking about it more now versus many, many years ago?
Right. So the first outbreak in the United States was in 2003, and it was limited to a few cases, like 40-something cases back in the day, and it was related to contact with animals, and it was contained. In 2022, there was a worldwide epidemic of Mpox in different countries in Europe, in the US, South America, and Africa, and it became like hundreds of thousands of cases during that time. With the vaccination, the prevention, and other measures put in place, it went away practically very few cases in the subsequent years. And now we had a slight uptake. We had little more than 100 cases during the summer. So I think with the measures put in place after the 2022 outbreak, a lot of things were contained and people developed immunity.
Very interesting. And then in terms of preventative measures, what do we need to know?
The single most important prevention measure is vaccination. So vaccine is very important, and we actually saw the most cases that were detected in 2025 didn't get vaccinated. So half of the cases didn't get vaccinated, and plus 15% go on one dose of vaccine. The vaccine consists in a subcutaneous dose of 2 doses of the vaccine within 28 days. So the minimum time length between the first dose and the second dose is 28 days. The vaccine is available for free in different places, including all Cook County clinics. And we're going to have an event at the Core Center on the 15th. We're going to have a pop-up clinic that's free for everybody. Anyone can come between 9 a.m. and 3 p.m. to get vaccinated. And avoid exposure, right? So the exposure, if you have somebody, if your partner has lesions and you avoid contact with the lesions, you decrease the number of partners, decrease the number of contacts that you should be preventing the spread of the disease as well.
Are we seeing this in certain demographics more than others?
With men, and but yeah, so in this case, in the cases right now, they were more concentrated in the north side of the city rather than spread all over. Here at Cook County, we saw many less cases than in other facilities up north. So I think still the people at risk are people that are exchange sex for money or sex for drugs or favors, and people with multiple partners. And every time you have more contact with more people and more skin-to-skin contact, or if you have a household or a partner at home that developed the lesions, then you're more at risk of getting the infection. So, but that has been similar to the population that was more exposed last time as well.
So I want to ask you a couple of things in terms of that. One, if you suspect that maybe you were exposed to it, what do you do?
So we suspected if you got exposed to that is that limit your contact with other people, mostly sexual contact, and watch for symptoms, and you can get vaccinated.
Okay, and then on the other side of that, how do you address vaccine hesitancy? Because to me, it kind of tracks that you would say, okay, well, we kind of saw an uptick around 2022, 2023, coming after COVID, where there was so much conversation about vaccines, that maybe there's just vaccine hesitancy overall now.
Yeah, it's true. So vaccine hesitancy is a problem for all kinds of infectious disease, including Mpox. But the vaccine exists and it prevents the infection. It's a good tool that we have to use. In addition to vaccination, is just avoiding contact. Reduce skin-to-skin contact.
And do you think we will continue to see upticks in the summer with this, and just kind of this is kind of where we are from now on?
Possibly. We never know what is going to happen with the virus and the population behavior, but it's probable that it is going to come back every time you have an increase in for contact between people. I think it's possible that is going to come back, but it also may take a few years to come back. We don't know. The best way to prevent further upticks is getting the more people immunized as possible. Good thing, different from COVID, Mpox, you don't get it again, right? So you acquire immunity when you're exposed to the virus, or when you're vaccinated only once.
Okay, Dr. Mercon, thank you so much. And again, just tell me one more time the events that you have where people can go to get these vaccines.
Okay, so you can get vaccinated in any clinic of Cook County Health. You can also have other facilities across the city of Chicago and suburban county. You can look at the CDPH or CCDPH website to look for events. The event we have here at the Core Center will be held on November 15th. From 9 a.m. to 3 p.m. is free for everybody that comes in through the door. And, we don't need appointments. You just come in and you get either your first dose of the vaccine or a second dose of the vaccine.
Thank you so much for your help today and for what you do on a regular basis.
You too. Thank you.